Welcome to this comprehensive lecture on medical nanotechnology, focusing specifically on the use of nanoparticles for targeted antibiotic delivery. In this script, we will cover a range of topics, from the synthesis and characterization of nanoparticles to their interactions with cells. We will also discuss various targeting strategies, controlled release mechanisms, pharmacokinetics, safety considerations, antibiotic resistance, localized and systemic delivery, prophylaxis applications, and the integration of nanoparticles with imaging techniques for antibiotic delivery. Nanoparticles have emerged as promising tools for targeted antibiotic delivery due to their unique properties and ability to interact with various biological systems. These nanoscale materials can be engineered to carry and release antibiotics at specific sites within the body, minimizing systemic side effects and maximizing efficacy. By precisely controlling the size, shape, surface properties, and drug loading capacity of nanoparticles, we can enhance their therapeutic potential. Furthermore, nanoparticles can be functionalized with specific targeting ligands or antibodies to facilitate active targeting to specific tissues or cells. In order to harness the potential of nanoparticles for targeted antibiotic delivery, it is essential to have a good understanding of their synthesis and characterization methodologies. Several techniques such as chemical precipitation, sol-gel methods, and vapor deposition have been developed to synthesize nanoparticles with controlled properties. Furthermore, advanced characterization techniques like transmission electron microscopy, TEM, dynamic light scattering, DLS, and X-ray diffraction, XRD, play a crucial role in determining the size, morphology, and composition of nanoparticles. Understanding the interactions between nanoparticles and cells is essential for successful targeted antibiotic delivery. Once administered, nanoparticles encounter various barriers, such as the extracellular matrix, cellular uptake mechanisms, and intracellular trafficking. It is important to investigate how nanoparticles are internalized by cells, how they escape lysosomal degradation, and how they release antibiotics at their targeted sites. Additionally, studying the cellular responses and potential toxicity associated with nanoparticle exposure is crucial for safe and effective application. Targeting strategies play a pivotal role in directing nanoparticles to specific tissues or cells. Passive targeting exploits the enhanced permeability and retention effect, EPR, which allows nanoparticles to accumulate in tumor tissues due to their leaky vasculature. Active targeting involves functionalizing nanoparticles with ligands that can selectively bind to receptors overexpressed in diseased tissues or cells. This active targeting strategy enables precise drug delivery and reduces off-target effects. Controlling the release of antibiotics from nanoparticles is critical to achieving optimal therapeutic outcomes. By incorporating antibiotics within the nanoparticle structure or through surface adsorption, we can design systems that release drugs in a controlled manner. Different release mechanisms, such as diffusion, degradation, or stimuli-responsive strategies, can be employed to achieve sustained drug release, prolonging the therapeutic effect and minimizing the frequency of administration. Understanding the pharmacokinetics and biodistribution of nanoparticles is crucial for their successful translation into clinical applications. Factors such as particle size, surface charge, coating, and route of administration determine their fate in the body. Studying parameters like circulation half-life, tissue distribution, and clearance pathways helps in optimizing nanoparticle design for efficient antibiotic delivery and reducing potential toxic effects. The safety and toxicity of nanoparticles are fundamental aspects that need to be thoroughly addressed before their clinical use. Nanoparticles can interact with various biological components, potentially causing adverse effects. Long-term studies are required to assess the potential accumulation of nanoparticles in vital organs and evaluate their biocompatibility. Furthermore, understanding the mechanism of nanoparticle-induced toxicity and developing strategies to mitigate these effects are essential for safe and effective clinical translation. Antibiotic resistance is a global health concern, highlighting the urgent need for alternative therapeutic approaches. Nanoparticles offer diverse opportunities to combat antibiotic resistance by improving the efficacy of existing antibiotics or delivering novel therapeutic agents. By leveraging nanoparticle properties, such as improved drug stability, enhanced intracellular penetration, and circumvention of resistance mechanisms, we can overcome some of the challenges posed by multi-drug-resistant bacterial infections. Localized antibiotic delivery using nanoparticles provides a targeted approach for treating localized infections or reducing systemic antibiotic use. Utilizing the inherent properties of nanoparticles, such as prolonged drug release, sustained drug concentrations, and improved antibiotic penetration, we can enhance therapeutic efficacy while minimizing adverse effects. Additionally, localized delivery strategies offer the possibility of reducing antibiotic resistance development by utilizing high drug concentrations while sparing systemic exposure. Systemic antibiotic delivery using nanoparticles allows for the treatment of infections that are difficult to access or target using conventional antibiotic therapy. Nanoparticles can be engineered to bypass biological barriers, such as the blood-brain barrier or the mucosal barrier, enabling effective antibiotic delivery to these challenging sites. By encapsulating antibiotics within nanoparticles or conjugating them onto the nanoparticle surface, we can enhance drug stability, prolong circulation time, and improve tissue penetration. Nanoparticles also hold great potential for antibiotic prophylaxis, preventing infections during surgical procedures or in high-risk populations. By designing nanoparticle formulations to release antibiotics in a sustained manner, we can create protective coatings or implants that prevent bacterial colonization or biofilm formation. This approach reduces the need for systemic antibiotics and minimizes the development of antibiotic resistance. Combining nanoparticles with imaging techniques offers new opportunities for visualizing and monitoring antibiotic delivery. Imaging modalities, such as magnetic resonance imaging, MRI, computed tomography, CT, and fluorescence imaging, allow real-time tracking of nanoparticles and assessment of their distribution within the body. This integration of imaging and therapeutic nanosystems can guide treatment strategies, optimize dosing, and evaluate treatment responses. In conclusion, the use of nanoparticles for targeted antibiotic delivery represents a promising approach in the field of medical nanotechnology. Through the careful design and characterization of nanoparticles, we can enhance antibiotic efficacy while minimizing systemic side effects. Continued research and development in this area hold the potential to revolutionize antibiotic therapy and address the challenges posed by antibiotic resistance.